My journey in choosing Inspired Spine started when I had some back pain, but then it became very exacerbated. I got to the point where I couldn't walk very much, I couldn't sit very long. And the only thing that would alleviate the pain is for me to lay down completely still. And that was the only way. I kept experiencing feelings in the lower back, and it was radiating down my right leg, and it was like a squeezing sensation that wouldn't stop, and it really began to affect the quality of life. And this is with me taking pain medicine and also an anti-inflammatory Mobic to alleviate, and those weren't helping anymore. So I figured I had to do something more, and I made an appointment with a surgeon back home, and I'm from Oregon, Portland, Oregon, and back there we did the imaging, X-ray, MRI, and it was determined that I had severe damage in between my L4 and L5 vertebrae. The options that were given to me were laminectomy with fusion, and so forth, but the limitations were that hospital system did not practice on patients who had a BMI greater than 40. I have a condition called lipedema, and I have lymphedema. It would really be very challenging for me to get down to that BMI. And due to my lymphedema and the fluctuations of fluid, it would vary a lot, and it'd be very hard. So I went after that visit I just looked online to see high BMI and back surgery, and I found Inspired Health. And I looked at by trade, I'm a pathologist, I'm a physician. So I looked at the peer-reviewed literature behind that. I saw literature out of Europe, and his literature, Dr. Abbasi, that really supported using the surgery to treat those with higher BMIs. And I like the philosophy of looking at the entire person. I do not have diabetes, I do not have high blood pressure, I do not have sleep apnea. I am just a healthy person who was given the body that I was given, and I do everything possible. I'm very active, I dance, I swim, I bike a lot. Matter of fact, before all of this, I did Peloton every day, and afterwards I would go swimming to help with my lymphedema and lipedema. And with this back pain, it restricted all of that, and really, like I said, started affecting the quality of life. When I looked more into his approach, one of the things that I noticed in comparison to the traditional method that I was offered is that one is minimally invasive and is not open, and so your risk of infection is significantly less. Also, too, when you're going through this process, they express and they harp on doing a lot of physical therapy to strengthen the muscles of your spine. While that makes sense, what doesn't make sense to me is that in the traditional method, you actually cut and disrupt those muscles. And when you're cutting it, you're also you're cutting the nerves as well. So, as you know, when you cut those things, that scar tissue develops, and you don't get any regeneration, and so you lose the stability of the spine. And to me, that just didn't make sense. Whereas this approach, he tells you to do the therapy so you can strengthen the muscles. He does the surgery, he doesn't disrupt those muscles. So when you're done, you still have that strength, you still have that scaffolding and that foundation to help you with your recovery. And that to me made more sense than the longer approach. Also, the time that you're down is much less, and you just have to worry about the bone growth. And once that's complete, then you can go on. So I feel that with that approach, I have a better chance to regain the quality of life that I once had. If not, it'll be vastly improved than what I'm going through right now. So that's why I chose Inspired Spine.